Thank you so much for joining us today. Good afternoon. My name is Rachel Nance Wade. I am the VP of Marketing here at May. May is a digital health platform designed specifically to support Black pregnancy. We are an engagement platform where we provide weekly pregnancy tracking, risk assessment, and resources for our members. We also have virtual interactive education for your pregnancy, postpartum, and motherhood journey. And we collaborate with insurance partners in specific states to connect our members with local community-based doula support. We believe strongly that combining this doula support with the digital health is going to dramatically impact our pregnancy outcomes. So we are also equally focused on supporting and bolstering Black birth workers as well. Today, I am incredibly honored to be joined by two members of the Blue Cross and Blue Shield of Illinois team. May is collaborating with this team in Illinois to support their members and local birth workers. And we are really excited to have a conversation about why Black maternal health is such a priority for a large insurance company like Blue Cross and Blue Shield, and how these programs come together and really how they really work to benefit you. So before we begin, I want to quickly introduce our panel. Joining us today is Tiffany Davis. She is the Executive Director of Quality Improvement and Health Equity at Blue Cross and Blue Shield of Illinois. We have Tammy Smith, who is the Senior Business Consultant for Blue Cross and Blue Shield of Illinois. We have Maya Hartigan, who is our founder and CEO here at May. And we are joined by Maya Gokhale, a Program Manager for Payer Partnerships at May. So before we to jump in, I'm excited to get started. And Tiffany, let's start with you. Can you just kind of talk briefly about why, for such a large insurance company like Blue Cross and Blue Shield of Illinois, Black maternal health is a priority for you, and kind of what the goal of collaborations like this are?
Absolutely. And thank you, Rachel. Thank you for organizing us, and just being here today is so incredibly important. I really appreciate the opportunity to partner and to just talk with you. I think one of the things that we think about in all of our collaboration from a health equity standpoint is thinking about broad opportunities for us to impact health outcomes. And Black maternal health, unfortunately, from an insurance standpoint, is a crisis. And when we look at the outcomes that Black women face in delivery and in birthing options, they're abysmal. We die at higher rates. We have poor outcomes in terms of feeling seen, heard, appreciated, centering our previous experiences and acknowledging that in the healthcare system, there is rooted inequities, systemic racism. There are just significant barriers that have historically formed how Black women receive healthcare, and then also that play out now. And so I think that when we talk about how we show up and live out our mission, which is to stand with our members in sickness and in health, we can't ignore this really pervasive problem in society. And it's not just our Blue Cross and Blue Shield, actually our associations. When you think about like the Blue Crosses across the country, maternal health and addressing maternal health outcomes is a key focus area, because we know that we have to reverse the curve. We have to look at this problem differently. And like you said, whether that's combining technology and community-based solutions through doulas, whether that is making partnerships with providers that are in maternal health deserts and creating different ecosystems of care. Like, I think we have to look at this across a very dynamic way and say, how can we show up in each space? And whether that's from a policy, whether that's at the practice, whether that's in our interactions with our members, whether that's the entire family, we have to look at every single lever that we can pull and ask ourselves how we can reverse that. And for us, focusing on health equity, because of the disparities that we see as a country and the disparities that we see in our membership, it's important for us to have partnerships that really are focused on disrupting and ultimately dismantling those disparities.
And we're honored to be part of some of those solutions. So Maya, can you just kind of speak a little bit to the why for kind of this work, and May, and kind of what we hope to bring to this collaboration?
Yeah, I'm happy to, and really grateful as well to be having this conversation with all of you. It is so important. It's important for us to talk about. I'm going to just rewind a little bit and talk about how May came to be, right? I think I am someone who has spent the better part of 20 years in healthcare on the business side, had been over the course of those 20 years in lots of conversations around the flow of dollars, right? And funding of healthcare services and how it all comes together and who receives those dollars. And I can say that for me personally, as a Black woman, and very often as the only Black woman in those rooms, not enough of the conversation was going towards equity and the health and prosperity, right, that has the potential to support for Black women and Black mothers. Also just knowing and understanding the extent to which, right, a life of good health and prosperity and one's ability to thrive actually begins in the womb and is formed so much in those earliest years, right? So I had a bit of a career pivot 3 years ago where I decided to focus in on that, right? Supporting healthier starts, working towards driving equity in minority health specifically, and really wanting to root that focus in established clinical interventions and things that we all collectively understand, do, and can make an impact, right? Part of why that's so important is because it's necessary, but part of why that's so important is also because it allows us then to work with some of the largest healthcare payers in the country, right, to both do right by people, but to help them also achieve and deliver some of their priorities as a business, right, which we all just know, right? I can say that for many of our partners, and most certainly for Tammy and for Tiffany, that the heart is there, right? The commitment is there, but sometimes that's not enough, right? Sometimes that's not enough to actually push investment and new initiatives and innovation over the line. And so it was really important when we were thinking about May and what this solution could be. It was really important for us to think about how we drive clinical outcomes, but also how we can drive some of those operational and financial priorities of the healthcare payers that we aspired to work with. And what I can say of this partnership is that coming up with that solution is not enough, right? It's also critically important that you have the partners with the heart and with the commitment to actually bringing those solutions to life and making sure their membership are aware, making sure there's a pathway for their membership to actually make the most out of those innovations. I know that our partners at Blue Cross Blue Shield of Illinois have done a lot in this space of maternal health equity that expands even beyond the relationship with May. And so I'll just say that there's a deep gratitude from our side for that example that you're setting across the healthcare ecosystem. And we're rooting for you as a partner, but also just as fans. When I think about May and the specific scope of support that we're advancing in collaboration with our partners of Blue Cross Blue Shield of Illinois, one of the things that we are really working towards driving is a more holistic understanding and partnership with those members that we serve, right? So one of the things that we all collectively know is that so much of how an individual interacts with their health care depends on their circumstances, even beyond what's happening in the four walls of the doctor's office, right? Is mom in an hourly paid job, and is she losing pay for taking that half day to go to the doctor? Does she have transportation? Does she have childcare? What else is going on in her life, right? That can help us to better serve her and do that in a way that really has the potential to work, right? And so there are significant gaps, generally speaking, in understanding, right? Not only of just that healthcare experience, but also those social determinants-oriented barriers to care. So making sure that we understand those in collaboration with the plan, and then making sure that we are working collaboratively towards addressing those barriers to care is one huge and significant component of our work. The other huge and significant component of our work, as Rachel shared at the top, is actually connecting these mothers with community-based providers who can step in and make that experience better, right? And so we have prioritized partnership with community-based doulas. This is another area where I would love to just give a shout out to our team of Blue Cross Blue Shield of Illinois, right? Where we know that many states have put in place reimbursement for doula support within Medicaid. We know that Illinois is moving down that path, and we're very excited to see that come. But one of the things that I will say about this team and partnership is that Tiffany, Tammy, the group at Blue Cross Blue Shield of Illinois said there's no reason for us to wait, right? We know that that data exists. We know that this has great capacity and potential to improve the experience of these experiences of these mothers, to improve the clinical outcomes for these mothers, to improve the start for these babies, right? And there's no reason for us to wait. Let's dive in, let's make the commitment, let's get started, let's set the foundation for something that can grow over time. And I think that, again, just setting that example is huge, right? Because it is showing others across the healthcare ecosystem, both within your state of Illinois and beyond your state of Illinois, what being brave in this regard looks like.
So first of all, anyone please jump in. I do not need to, so feel free to jump. But there's so much to unpack, and every time we talk, the conversation is just, there's so many pieces of this. But you mentioned representation, which we want to talk about at some point, but more so kind of first talking about that collaboration and talking about really understanding the members we're serving and how we kind of combine and do that. So I want to throw it to Tammy, because I know, you and Maya work very closely in terms of bringing kind of these big ideas to life. And can you just kind of talk a little bit about your priorities in that work and how you kind of approach this?
Yeah, and I think it is important what was just said, just making sure that we are keeping our members first. For you, May, and for us at Blue Cross Blue Shield of Illinois. And me personally, I've been working, in community with our member in community settings for a number of years. And I do understand the importance of member preference when it comes to effective communication and interactions with our members. And for our work to be successful, it really is critical to collect the important data, personal data, medical history, member feedback data, and our moms may not feel comfortable in disclosing certain sensitive information face to face, or may not have time to physically come in to attend an educational program or session, but may be willing to do so via a digital platform or over the phone with a doula, or perhaps in some virtual setting. So working with partners and providers who, also understand this, like May Health, can provide multiple ways for us to engage with members on their platform. And for us, that is key to building trust in the program and maintaining consistent participation with those members. So when we started with the collaborations here, working closely with the maternal focus groups and an organization like May really does strengthen our ongoing commitment as a health insurance payer to expanding access to care. And doulas are with the moms throughout the entire journey and build an incredible bond along the way. So it's that connection and feedback that's provided by the doulas, which helps us in really pinpointing those factors that contribute to the poor health outcomes and any disparities for our moms. So whether it's a need for better nutrition, educational needs, mental health, or some sort of physical support, the moms, as I said earlier, will sometimes share that experience with the doula that they may not express to their family or share with their doctor. And by helping us to really understand what is needed by our members, we can better define any gaps in care that may exist and develop solutions for those gaps that optimize health outcomes for all of our members. So that's really why I think that it's important to have that collaboration with May Health, because you do have the tools, you do have feet on the street, I should say, as well as virtual platforms. You have multiple ways to work with our members and make them feel comfortable.
So Maya G, I want to bring you in because that kind of speaks to how you collaborate with the team as well. So I want to give you some space to kind of share what your kind of role at May is and how you bring this kind of what piece you bring to the table too from our perspective.
Yeah, absolutely. So I think Tammy said it really well, that all of the different data that we collect through the May platform, through the doulas who support members who use our platform, and of course that the plan already has, like medical history, who is the provider, are they in a care management arrangement with the plan, you know, what benefits might they be using. All of that is really helpful for us to get a sense of, to best wrap around each member in care, so that they can not only have a really positive experience throughout their birthing journey, but also feel very taken care of each step of the way, because of course life does not operate on a schedule of, you know, you're going to get this symptom the day of your doctor's appointment and you can go in and talk to them, right? You know, it can be really intimidating in those environments to, when you have a million checklist questions to ask, to remember something like, how's my mental health doing? Or, and actually I had a little bit of trouble getting to this appointment. The bus wasn't running and I needed to arrange childcare. Also, I don't know how to set up the crib when baby comes. So all of these things are super normal things for any pregnant person to experience, and particularly if it's the first time that your body is going through this, or that you've thought about being a parent. There's a million things that can pop up. So I think it's from the May side a real responsibility for us to know that, you know, one, we need to build that trusted relationship with the member so that we have an opportunity to receive some of this information they might not feel comfortable or not know that they can share in the traditional healthcare setting. So whether that's through the doula or through our platform or through our care coordinator when they do outreach, part of the way that we collaborate with Tammy's team and with the plan is just simple enough, just letting them know in a timely fashion. And so that the plan can not only support with all the resources that they are already offering, such as, you know, care coordination to get someone an appointment for a follow-up visit if someone is expressing, you know, an urgent clinical symptom, to all the different offerings that the plan provides that can go underutilized often, you know, transportation resources, if there's a food pantry nearby in the community that the member lives in, if there's resources for car seats or diapers, things like that that are, you know, you might not traditionally think of as being offered in a healthcare setting. Those are things that we like to collaborate with the plan on to make sure, hey, this member has expressed this need. They might not need it right in this moment, but they'll probably need it lined up for later. We just make sure that the plan knows that, and then we utilize the relationship that we have as kind of a third-party collaborator that's, you know, just an app that the member's using to through the doula or through the platform or through one of our team members, just let the member know, here's what the plan can provide you, and we're happy to make that connection. And we love seeing that come full circle, because oftentimes it will be raised in a simple conversation with the doula. Hey, I'm having trouble getting access to healthy food, and just knowing that there's a resource out there and there's a way to support that member that can make a huge difference in someone's day, and just making sure that the pregnancy journey they have is as healthy as possible. And I should add that this isn't just the prenatal period, but we collaborate with each other just postpartum as well, and we really focus on taking care of newborn resources, and then mental health, and just making sure that our members are supported every step of the way. So it's been a real privilege to work with Tammy's team, and we have entire systems I won't bore the audience with today of, you know, if something is urgent versus less urgent, and the flow of how we get that person care. But the whole point, as Tammy and everyone on this call has said, is just making sure that our mamas and pregnant members feel as supported as possible and loved and just cared for throughout this process, so that they can feel excited and empowered and joyful throughout this pregnancy.
Absolutely.
As we were, you know, as Maya mentioned at the top, the why, and of course, as Tiffany mentioned, you know, the statistics are incredibly scary and daunting, and we have an opportunity to make someone's experience of the pregnancy feel just that little bit more supported, and move to a place of excitement and joy amidst all of the challenges that one might be facing. So it's an honor to be able to work together to support that.
Absolutely. Absolutely. And that's well said, Maya, because we can't do this alone as a health payer. We do see the importance of our strategic partners out there. And the success of any planned interventions, regardless of, what they are, really, if they're informational or, they're focused on a specific need like maternal health, that really is going to depend on building strong partnerships with our community thought leaders, with our other community-based organizations out there as well. And having the assistance or having the ability to guide our members on a platform like May gives us the opportunity to get in front of any issues, as you mentioned before. So this should be a joyous time for the moms, and we want them to enjoy this experience, not worried about a food insecurity or the fact that maybe they can't quite get an appointment with their physician. If we are alerted of that ahead of time, then we can pull that internally to our internal teams and have our care managers involved in helping them with that. If that means, working with them one-on-one to get them in contact with one of our contracted providers, or it means connecting them with an outside resource like our Blue Door Neighborhood Centers or another community-based organization, that helps us. So yes, it takes all of us. We definitely cannot do it alone.
And that, that kind of connects everything, like all of the pieces that May is bringing to the table and all of the pieces that Blue Cross and Blue Shield of Illinois brings to the table. And to your point, Maya, the way that we can actually impact and improve somebody's experience on a day-to-day. So Tiffany, kind of big picture, kind of the goal is to have an impact collectively, work together. We already see some impact from this work, but kind of can you speak to kind of just the general, what we hope to achieve and where we hope to go, and maybe what we've seen so far based on some of the work we've done?
Yeah, I want to take a minute and take a step back of why collective impact is so important for us. And usually I start all of our health equity conversations and thoughts with collective impact, because is that principle is understood in public health. I'm an attorney by trade, and so it was not a principle out you tend to kind of see problems and go and fix them singularly, right? But there's an African proverb that says if you want to go fast, go alone. If you want to go far, go together. And I think that proverb grounds how I think about collective impact, which is that in order for us to go far and disrupt and completely remove the disparities that Black women face, that takes us all looking at the problem. And so we kind of have a multi-layer approach. So we think about that from a policy standpoint of, are there policies that we could be recommending as a payer? For example, the expansion of maternal health benefits. I mean, health equity starts with just access to care. And so if you're fundamentally in a place after you've delivered a baby and you lose access to health care, that can be really disruptive, not only to the mom, but also, to the baby or to anyone else that may be disrupted from access to care. And so advocating for the expansion of those maternal health benefits was really, really important for us postpartum. And so we've seen that in some of our markets where even if someone loses Medicaid eligibility, and this was obviously a lot before the pandemic, and you had redeterminations where everybody stayed on, but it's really important now as redeterminations are starting back up. And so just this whole idea of policy, and then we think about partnerships, collaborations like we're talking about today. We think about interpersonal, so how do we bring the whole family along, right? We think about individual, and that's the beauty of this, what we're talking about here, is that sometimes we can cut across all of those areas, right? We can learn policy, we can, go a little further than maybe where we are and kind of make sure these services are available. We can do, we're talking about family, and, so I think that to the extent that interventions can cut across all of those layers, they're really, really impactful. And so what I want to see and where I want us to go is to be able to like, you know, a year from now, yes, we got our moms access to loving and supportive, and they had a joyous birthing experience, and they had, you know, I think I look at the stats that come over, you know, our doulas were there and they were present at the birth. But also, like, you know, do our moms that are going through the program, do they feel empowered to maybe become a doula? Or do they feel empowered to share the importance of doula is a low cost, highly effective intervention, right? When we say, you know, the billions of dollars that we can spend when a birth does not go in a way where a mom has a joyous or a happy experience, it can be very costly, it can be very traumatic. And so to the extent that we have higher rates of moms feeling incredibly satisfied, they feel seen, they feel heard, those statistics to me are really, really important, in addition to lower avoidable high costs from a delivery standpoint. So I think success looks like, you know, really high rates of member engagement. I think success looks like us being able to continue to weigh in this space as a payer. And so in advocating for pay equity, you know, just because the doula is a low cost intervention, that doesn't mean I think our doulas should be paid at low cost, right? I think our doulas need to be reimbursed at a rate that is fair and that is equitable. I think to the extent we can integrate and resolve those social determinants of health, so often in the work that we're doing in equity, we see a combination of social determinants that will come up. So how is housing impacting that birthing outcome? How is food security impacting that birthing outcome? How our mental health and, you know, our ability to engage our moms and get those screenings done, and make sure that there's postpartum support in place. Or do we have good birth spacing, right? Like where mom has a chance to really be able, or mom or birthing person has a chance to really be able to, you know, enjoy and celebrate the birth of a new child, but also plan ahead for the next one. And so I think there are so many things when I think about where I envision this and what we can learn. And I hope that the combination of all of that is that we can like stand, you know, and be able to say that like, this is like table stakes, right? If we're going to do equity and we're going to improve Black maternal health outcomes, you have to have a way to engage, like you all were talking about, and like normalizing. This shouldn't be an exception, right? This should be the norm. We should make sure that our moms have the option to these types of services. They're available, they're accessible, you know, across, regardless of where someone is coming from. And that to me is equity, right? Equity is so much about, regardless of where you're starting from in this continuum, you have access to high quality services. And so, and high quality healthcare to thrive, right? Not just to check a box, but to really, really thrive. And so, you know, I think those are like, when I think about the bigger picture, those are some of the metrics or the benchmarks for success that are really important to me.
I would just say one thing that strikes me, both in terms of our experiences over the last few years, but also just in hearing you communicate that, Tiffany, is just how interconnected all of these things are, right? So the social determinants oriented factors drive healthcare utilization, drive satisfaction with care, drive clinical outcomes. Our ability to more effectively serve mothers with all of those things allows us to generate the data, right, around clinical outcomes, cost savings, cost avoidance for all sorts of things that we should be able to mitigate, right, preterm labors, non-medically indicated C-sections. And then having that base of data will then allow us to play a more meaningful role in advocating for improved regulations for more holistic care, right? Improved regulations around doula reimbursement and compensation, such that we can have a huge and robust supply of community-based doula partners to support more mothers and just reinforce that entire cycle, right? So all of these things are interconnected, and I think it's always a struggle to think about, you know, balancing something that may be a point solution with going a little bit broader, but we certainly are thinking a lot about that entire life cycle, right? And it's not just the episode of care life cycle for the mother. It's managing that episode of care life cycle, and then it's all of what we do with the learnings and information that comes out of that experience we had with that mother, so that we can again advocate for more comprehensive services and advocate for higher reimbursement rates for these doula experts who are putting their heart and soul into servicing these mothers, right, to the betterment of communities, right, to the benefit of all taxpayers across the state if we do better with these maternal health outcomes. And I think we very often have a tendency to look at things too narrowly, right, or to think about things as they may impact the current fiscal year budget. And we just have to, I think we have to work and think a little bit more broadly, as you all are at Blue Cross Blue Shield of Illinois. But I think we have great potential, right, to actually create a body of evidence and to funnel that back into the advocacy and regulatory community, so that in 2 years we're offering more, and in 5 years we're offering more, and we're seeing some of those benefits really play out.
Yeah, and the thing I love what you said, Maya, that I think is also so important is sometimes we'll collect data, right? Like we'll like generate like all this outcome data, and like we'll look and see like our costs going down, or is utilization at a rate that that makes sense, and that data isn't often, at least in my experience, isn't often poured back into the delivery of services, right? And like how can we now serve better, faster, more compassionately, to create a better experience. And so one of the things that I loved about like that the feedback that I feel like we're getting early on is, you know, our members and our communities, and like not just our Blue Cross members, but I think the community of Black women is asking like, I want to have these, I want an advocate next to me, right? And I think that's a direct result of the outcomes of solutions like May, who are saying like, yeah, we're a data generator, right? We understand our population, we understand who we're servicing, and we can respond to what women are asking for, which is like someone that's going to stand here next to me and make sure that I'm seen, I'm heard, my needs are met. And I think that that's so incredible. And so I just want to applaud you and your team, because sometimes that's why the mistrust can exist in our community, because people will come into our communities, they'll extract, they'll take, and there isn't always a return on that, right? There isn't always a service on the other side of it. It's like, oh, yeah, we understand this problem. We see this problem, but now are there resources, or are there people, or is there a way that this can become better? And so I just, that's one of the things that also delights and excites me about about the work.
Yeah, I mean, one of the things super quick, you know, Maya made a point earlier around so many of the mothers we serve entering into their pregnancies from a place of fear, right? And that's because we're reading the statistics, we're seeing the reports and the data around marginalization in the care of Black women, around Black women not being listened to if they have symptoms, if they have pain, all of these sorts of things we're all very familiar with, right? And so I think this idea of reshaping that experience and really making sure that we're bringing an effective model for advocacy to the table, it's helping people to feel a little bit less vulnerable in that experience, right? And again, when we think about all of the things that burden us and distract us from our own self-care and from all of the things that we need to be doing to manage a healthy pregnancy, I think that fear is a distraction, right? It's understood, but it's a distraction. And so anything that we can do to make mothers feel more, birthing people, feel more comfortable and confident and supported in that experience, I think can be so meaningful just in reshaping that experience, but also reducing stress for Black mothers, right? Also correlated with preterm labor, right? How can we make this happier, more comfortable, better supported, because we understand the clinical correlations there as well, right? So it's so important, I think, that we to the point that all of you have made, that we're thinking not only about just the hard and fast data and clinical outcomes, but really the experience that we're reshaping on behalf of these mothers. And then downstream, being able to illustrate where and how that reshaping of the experience can play a huge role, again, right, in driving outcomes, driving costs, and doing our part to help to communicate that within the regulatory communities.
I think that, oh, go ahead, Tammy.
Oh, no, I was just going to reiterate what Maya just said. That's what I think makes that platform so valuable is the constant check-ins. And then that information can be fed back to us daily, weekly, monthly, how we have it set up. And it focuses on the real-time care priorities, time-sensitive priorities, so that we can immediately recognize and address those factors that are associated with the overall health and well-being of our moms, and quickly addressing those age-related or chronic conditions, hypertension, obesity, diabetes, those known risk factors that equal poor maternal health outcomes. So we can intervene and address those sooner than later. But then also look back, over this period of time, over a year, over 2 years, and then really determine, okay, at this point, what do we need to develop to fill those gaps of care if it's not already there? What can actually make these experiences better for our mom? Is it educational focused? Is it working more with providers that take care of our moms? Or is it pulling in more community resources to make those available for our moms? So I think, having that platform available is really just a wonderful source of information for you all, for our moms, and for us at Blue Cross Blue Shield.
Yeah, I think there was a question in the chat around like how this aligns with the overall strategy of the association. And it's such a great question. And I'm really proud that our association came out and with a really bold and audacious goal, like, to say we want to see disparities in maternal health reduced by 50% in 5 years, like flat out, like we want to see the reduction of racial disparities in maternal health. And so when we as leaders hear calls of action like that, you have to respond. And I will say, as a Black woman, it's not easy in equity work looking at statistics every single day, seeing disparities that impact Black women. And this, I just in general, it is very hard to work in that type of space. However, what makes that work easier is like when you share that burden. That, to me, that's collective impact, right? How do we all come to the table and say, how do you mobilize resources? How do you mobilize partnerships? How do you mobilize ideas, relationships? How do you share power in a way that really reduces those disparities? So this partnership with May Health is exactly aligned to that. When we were introduced to Maya and her team, I was blown away, and I was blown away not only by their commitment and their heart, as Maya was saying earlier, but by the structure of the organization to do exactly what our pledge announced, right? Like, how do you collect the data? How do you focus solutions that are focused particularly at the disparity that you're trying to reduce? Like Maya is unapologetically and saying that this is a solution for Black women. Now, we've also talked about other disparities, like in our Hispanic community and our Native American community, and that's another part of the pledge, right? Like, how can you scale solutions that work? And so I've been really grateful in that when we talk, there's an incredible focus on really improving health outcomes of Black women, because that's where we see the most disparities. Black women die at 2 to 3 times of rates higher when they give birth than other populations across the country. And so for us to have a focused solution there, but then to see that we now have not only an idea with this partner, but they've been able to execute and show us that it can be scaled. And so for us, this partnership lived out so many of the things in terms of focus, in terms of being able to respond to a bold action, in terms of just being able to really be focused. And then to, as we talked about earlier, to see the type of data that allows us to serve better. Like, if this data is the collection of data just to collect it, like, not to say I'm not interested in it, but like, I want to make sure that we're looking at data and outcomes that help us to serve. And then the last thing that I think Maya and her team do so well is like empowering and working with community-based organizations. So for us, a part of our pledge in doing this work, we can't just do this from like, our office in downtown Chicago, right? Like we have to be able to co-design and co-labor and co-work in community. And so when the model was like, hey, we work with community-based doulas and making sure we're lifting them up, that just for me, from an equity standpoint and the work that we do with minority and women-owned businesses, that was so incredibly important. And so for me, this partnership, like I mentioned earlier, it cut across a few different ways of how we think about the work, not just in maternal health, but across several areas of reducing disparities. And for me, that's why I felt like it was in alignment. So hopefully that helped to answer the question.
I think that one of the things that we're talking about is, understanding who we're serving, and it's not lost on me that that we are creating solutions for ourselves. And so representation is incredibly important. Having our experiences inform the solutions that we're creating. So for everyone, I think that there's kind of a question around like the importance of representation, of the importance of us having a part in creating the solutions that are serving our community. Can you kind of speak to what it means to kind of be in a position to kind of drive these solutions forward for us, by us?
I'm happy to kick us off.
Yeah.
So I think one of the really important things, I think a lot of brilliant minds on our small team. I won't say that of myself, but I'll say it for the folks who are leading the day-to-day work. But also a really critical thing that we look for when we're growing our team is ability to serve with that understanding and empathy of the individuals that we have built this for, right? And for many of us, I would say that we are so far a team of all women, but also disproportionately women of color, disproportionately Black women, disproportionately mothers, right, who have all been touched by this in some way, right? Even the folks on our team who are not yet mothers have been touched by this in some way, right? Loved ones, friends, family members, and all feel an incredibly deep commitment to change, but also are incredibly thoughtful in terms of how we build our model and support structure, right? And I can tell you that from the earliest days when we were building May and we were thinking even about some of those weekly check-in questions, the conversation was, these are some of the things that we need to understand, and how can we be most sensitive in how we ask, right? Because it is important for us to understand these things, but it is also important for us not to lead from a place of bias or assumption, and not to ostracize any of the community that we're serving, right? And I think that we were incredibly thoughtful as a team, in part because we were thinking, how would we feel if we received this question? How would we feel if we received a question about domestic violence or substance abuse, right? And that doesn't speak to our lived experience, and it very much feels like it's coming from a place of judgment, but we still want to understand, right? Just in the vein of understanding the totality of that lived experience. And so we have been incredibly thoughtful as a team, in part because we do share this lived experience, many of us do, to ask those questions in the right way and to put ourselves in the shoes of the recipients of our product and solution offering, right? To understand, how would we feel? How would we respond? Is this the right way to phrase this, right? Is this the right way to ask? And if we need to ask the tough questions, let's be sure that we're communicating why we need to understand this, right? And why it's meaningful to have this very difficult conversation. And so, I am a Black mother of 3. Rachel's a Black mother of 3. Our clinical director is a Black mother of 3. Our head of product is a Black mother of 3. I think that all of us collectively on the team are very rooted in how this solution would make us feel. Would it make us feel respected? Would it make us feel valued and served, right? And so it's really important to lead from that place of understanding and empathy, which isn't to say that individuals who aren't women or aren't Black couldn't make meaningful change, right? And put their weight into equity. I think we should all commit ourselves to equity, but I do think it hits a little different, right? I think it hits a little different when we're building with that perspective and with that lived experience. I will also just say that I think based on feedback we get from our users, that also matters a lot to them, right? And so it matters a lot that we are a Black women-led team. It matters a lot that the individuals that we're partnering with in community, those doulas that we work with, are also understanding of the lived experiences of the individuals we serve. And sometimes we hear that very directly, right? Our care coordinators will say, I called this mom today from the roster and she said, are you Black? And I said, yes. And then she said, are the doulas you work with Black? And we said, yes. And then she said, sign me up. Right. Because again, this is a little bit of a funny story, but it too is rooted in evidence, right? Where we know that where we have that cultural alignment on our care teams, again, there's evidence around this, right, to suggest that where we have that cultural alignment and understanding and support on our care teams, that it tends to make a difference, right? And I think for Black Americans, I'm probably not current on these statistics, but we're about 14% of the population and we're about 4% of the workforce of physicians, right? So for all of us who aspire to have a Black OBGYN, we simply may not be able to find one because those demographics are so misaligned, right? And so we'll all aspire to find the best doctor we can find, irrespective of race, right? But for many people who want to have that cultural alignment on our care team, it's not necessarily there in our core care team, right? And so part of this exercise is understanding where we can supplement those care teams to make sure that that respect is there and brought to these mothers in a way that will serve them. And so we're really proud, I think, to be able to play a role in that as well.
And it's actually important to consider culture and those cultural norms and history and how people relate to one another when you are serving a population, because that does really factor into behavior. It factors into how we do things as a family, as individuals. And when you can have a program that will allow you to connect and relate your issues, concerns, fears to other Black women like you who have been through a process and really understand what you're going through and can communicate with you and make you feel comfortable, that's important too. So I think it was a good thing to kind of touch on that for people that, may say, oh, okay, well, we're focused on, Black women, Black care, having Black doulas. But again, I think you hit it on the head by saying that level of comfort and also that level of understanding that, for Black women, as Tiffany noted, as you noted, 3 times more likely, to die of a pregnancy-related cause. And if whatever we can do to kind of alleviate some of that anxiety, walk the moms through that process, make sure that the moms and their families are receiving the right tools and the right education about their pregnancies, will allow them to enjoy that process and enjoy that journey. And will also allow us to communicate better with them and really understand what the need is and to be represented, as the question was posed, why representation is important. And this is why.
Can I add in a comment here, Rachel? Kind of related to what we were talking about before. I think the representation is something that, as a non-Black woman of color, I feel very honored and privileged to participate in this work and support what we do. And I think, Tammy, Maya, Tiffany, Rachel kind of all spoke to the different important pieces of representation and why it's critical to the work that we're doing in an effort to move the needle on these health equity initiatives and improve maternal health outcomes. And I think one thing that is special about May and our collaboration with Blue Cross Blue Shield of Illinois is really that consistency in what we're doing as well. I was thinking about that as we were talking, where we're offering a consistent touch point and showing up, in the form of our platform, our phone calls, these doula sessions. That is something that is consistent and unwavering throughout what can be a very turbulent time for people if something's going on with their life, or the changes in your body and in your mind during pregnancy. And of course, racism and sexism on top of all of that, having a consistent, friendly, and trusted resource, someone checking in with you is really huge. And it's a really simple intervention, but it can be really meaningful. And I was also thinking about doulas in particular. They're a form of consistency for a mom or birthing person throughout the prenatal period. And then when you get to labor and delivery, maybe your OB will not be free that day. You can't always rely on that, but having this advocate that's there to say, I know what the birth plan is. You focus on taking care of yourself during, all the different things happening in your body during labor and delivery, and I'll advocate for you and I'll be there to support you. Having just that trusted resource, I got you kind of feeling, I think is something that's really powerful that we're able to collaborate and provide together, and then including into the certain period. And so I think that representation plus the continuing to show up for each other is really how that plays out in a really special way. And it's why we have some of the strong outcomes and births that we've seen so far. So I just want to talk through that too.
And I think I keep coming back to this. I was listening to, I think it was the National Birth Equity Initiative during Black Maternal Health Week. And they were talking about a pilot that they're starting with the Robert Wood Johnson Foundation. It was around changing some of the patient reported outcomes to where like questions like, do you feel seen? Do you feel heard? Are now part of how you measure the quality and success of an experience. And particularly if you're servicing Black women. And I just was thinking about the times in my professional career where I've not felt seen, I've not felt heard, and and in the medical, like not feel seen, not feel heard. And unfortunately, at least in my experience, I went to a HBCU for Black women, been in college for women in North Carolina, went to a HBCU for law school. Like I've been in so many settings where I've just seen where Black women have been seen and heard, and they have been lifted up and championed and like propelled to go out into society and to thrive. Like you feel that in those HBCU environments. Mm-hmm. And in some ways, that's how I feel with our interaction is like, I know that the women that will interact with this platform or will interact with a doula, they'll feel seen and heard, and then that becomes a bolstering and an ability to thrive. And again, that's what equity is about, right? Like, how do we acknowledge these systemic things that that may work against and may contribute to why these disparities are here, and say, yes, these are here, and now how do we stand up in the midst of that and serve and support and provide resources? And so I think, to me, the representation, I've seen it play out in so many different ways. And when you have the opportunity to feel seen and heard, it becomes the platform of being able to thrive. And so that to me feels so important, not only in my own personal, like professional, but I want that for our members. I want that for the women that we're serving. And so, that just feels important to me. So I wanted to share that.
And just to tag on to that too, I think that we're able to kind of provide that for the doulas and birth workers that we're working with too, and really provide more opportunities to kind of grow and build their business from a whole different kind of standpoint, is also really impacting representation in that birth worker space too. There's a number of barriers that have kind of prevented us from thriving in that space. And so that's another side of it for sure. We are close to time, but I know we started a few minutes late. So before we close, is there anything anyone else would love to kind of share before we go? We had, I'm not seeing any questions right now, so I will kind of keep us close to the time, but thank you so much for joining us. Thank you all for this conversation. Maya, do you want to say?
No, I just wanted to say, I just wanted to say to Tiffany and Tammy that we so appreciate the space to have this conversation, right? Because I think a lot of what we're challenged with collectively, our team at May, you both in your health equity work, is just raising the conversation, right? And I think talking about some of these very human experiences, and as we were saying a little bit earlier, pulling back from some of the statistics on the page and really thinking about the human experiences of every single person that we serve and how we can make those better. Step one is acknowledging the problem, talking about it, figuring out how we work together to improve it, and always operating, I think, from a place of listening and continuous learning, so we can get better and do better over time in partnership with one another. But I just wanted to thank you both for your partnership, but also thank you both for opportunities like this to talk about the collective impact we're working towards.
Thank you. And I echo the same thing. I have enjoyed working with you, and I'm looking forward to just continuing to collaborate, continuing to improve processes, and just continuing to work on things that will help improve the birthing experience for our moms and help improve the outcomes and help improve community in general. So thank you.
Yeah, thank you all. I know you're busy, and so just taking time out to talk and just connect in this way is really special. And these conversations do matter. Like, they help to normalize the work that we're doing in equity. And so I thank you all so much for making the space and time, but also for everything that you're doing every single day. And thank you, Tammy, for making sure that we could get this across the finish line. I'm so much gratitude for you and for this entire partnership. So thank you all.
Good work. It's good work. I'm enjoying it.
Tammy and Maya G are the stars behind the scenes making all of this run. It's been really incredible.
Takes a lot of us. We got a lot of folks over here on our teams over here at Blue Cross and Blue Shield and of Illinois. A lot of teams over there at May who are jumping in behind the scenes and making sure that our moms and their families and those babies are taken care of.
Yeah, and shout out to our doulas. They are doing the Lord's work every day with these moms, and it's incredible. They're not visible in this meeting, but they're absolutely a huge integral part of the work that we do every day.
It's really humbling to see, and I think that we don't acknowledge that contribution enough, right? So yes.
Yes, they are incredible. They inspire me every single day. And to your point, these conversations do matter, no pun intended, and we want to have them more and more. So I do hope that we can have this again too, and kind of check in and kind of see how it's going and share the work and share the challenges and share the wins, because it is collective work and we all can kind of contribute and we all have a voice in this space. We will have a replay of this conversation. So I am going to make sure that we share the YouTube link. You can get it at May Health Inc. on YouTube. We will post a replay there. We will also have additional resources and ways to just be part of the community. So follow us at May Health Inc. on Instagram. And again, I think to your point, anyone who is looking for pregnancy support, any doulas who are looking for supporting this population, anyone in your universe who is looking for postpartum support after they've delivered. We want to really support every stage of this motherhood journey because it continues. There's a spectrum. So please visit us at meetmay.com for more information. Doulas can go to meetmay.com/doula. And again, thank you. I hope to have you back to continue and revisit this incredible collaboration. And thank you for all of your commitment to this work.
Thank you for having us.
Thank you all.
Thank you. Bye.
Bye-bye.